Hi, welcome back to the Healing Medicine Show. This show is produced on Thursdays at 1 p.m. Central Time as part of the Healing Medicine newsletter. The vision for this show is to provide a platform for health and healing professionals to grow in their understanding and practice of what it means to be healers. So we aim to provide healthcare professionals with resources and inspiration for both personal and professional development practices, especially those that are rooted in holistic health. We believe that the change in healthcare starts by focusing on the health and the well-being of healthcare providers. So if you have a colleague who would enjoy this show, please send them the link to subscribe to this newsletter. So today I'm very excited to have my friend Helen Sairany. She's the author of Trading Grenades for Candy. She's an expert in trauma-informed care and also the executive vice president and CEO of the Florida Pharmacy Association. She is helping pharmacists to move through the era of discontent and into realignment through sharing her message and story through her book, through her keynotes, and through advocacy for the profession of pharmacy. Helen, thank you so much for joining us here today.
Really excited to be here, Blair, to share some of my insights and also some of my experiences with your audience. Thank you so much for having me.
I am super excited. We connect on so many levels. We both love traveling, other cultures. We love pharmacy and helping people and really helping pharmacists see themselves as healers. So the way I start off these interviews is the same way I ask everyone the same first question, which is, what does healing actually mean to you?
So it's a question that it requires a lot of deep thinking, simply because we live in a society that exploits trauma in all of us. I am a pharmacist, I am a healthcare provider, but I feel like until we master a holistic look at our patients, we're going to continue failing our patients. Because when it comes to the Western healthcare system, we compartmentalize the organs. So we treat the mind separate from the body separate from the soul. So to me, healing is about having a holistic look. It's about looking, at the human as a whole. And I like to say that we as humans, we have three brain systems. We have the actual brain, we have the heart as a brain system, and we also have the gut feeling, which is also connected to our the other two brains. So for you to develop mastery in any healthcare or any healing process, you absolutely have to look at the human being as a whole, entity, body, mind, and soul together. Until we are able to connect these three pieces together, we are going to continue failing our patients. And to me, that's what healing is: having a holistic look, finding us, and finding those three pieces and connecting them together.
I love what you said, really, about recognizing that we are failing our patients. And I think many healthcare professionals are feeling this, that the healthcare system has gotten quite out of hand. We're spending more money than ever before, and we're seeing poorer outcomes. We're actually seeing in the United States, the life expectancy going down. And so I think this, what we call modern medicine approach, which really kind of started 50 to 70 years ago with the advent of pharmaceutical medications, has done wonderful things for people. I mean, the technology that we have is wonderful. If I get hit by a bus, please take me to the hospital. But for things like chronic stress, for things like anxiety and depression, for things, for manifestations of symptoms that are not necessarily coming from our genetics or our diet or whatever, we don't have a good understanding and a good grasp on how to deal with those. So, you talked about being an expert in trauma-informed care. What does that exactly mean, and how can other healthcare professionals approach their patients with this level of understanding around trauma, around the whole mind, body, spirit connection?
So I think a good first step is to understand what disease is. Or again, going back to our training as a pharmacist, and I'm sure this is not a foreign concept to you, Blair. They look at disease as genetics, or as the way we look at it. It's more of like we have a reactionary look at how disease gets developed, which is, for example, let's look at addiction. Addiction is being looked at as either genetics or as a disease, which is a good improvement, considering not long ago, addiction was looked at as a flaw in behavior or as a choice. But for me, disease is an outcome. It's an outcome. It really is, from a life experience. And then you really have to have a hard look at how you've lived your life. Disease is a normal response. Disease is an awakening. Disease is a body's way of telling you something that you've ignored over the years. So until we have that hard look at a different look at what disease is, we are not going to understand why we are struggling, why we are suffering. So I like to say that disease is a normal response to an abnormal societal circumstance, and it's an outcome. It's a normal flow that is trying to go through your body. It's an energy, but when that energy gets disrupted, that is what it presents itself as, just like anything else in life. And I believe this is something that is really worthy looking at in order for us to understand what the society is doing, and when it comes to trauma. So when I say I am trauma-informed care, it's basically me having a hard look at how I understand disease. I see trauma to be the common template of all mental health diseases. Your early exposure to childhood adversity has a lot of indications in terms of what that early exposure means to you. It caused a lot of disruption in your healthy development, because 90% of the human brain development happens in the first 3 years of life. So until we have that deep understanding of the human development, the brain development, and having a different outlook at disease, we're going to continue having that reactionary look at disease and continue treating the symptoms of a disease and not looking at the root cause of what's causing all these conditions in us.
I think that reactionary medicine is the core of what you said about compartmentalizing. So really viewing the body as a machine, that there's one, I've always thought it was crazy. There's one neurotransmitter that's responsible for depression, or there's, one calcium channel that we block to put the heart back into rhythm. And so really this idea that all of our organ systems and everything in the body is functioning independently. Whereas when we look at something like Eastern medicine, when they're talking about energy, they're talking about the meridians in the body and how everything is in or out of balance within the system, and how the body works together to have this response to the environment. So I love what you said about disease being a natural response to abnormal environmental conditions. And we're living really in a society and a culture that we're looking for quick fixes. And I think that it may not be serving us to be giving our patients these quick fixes. So one example, I think about my grandmother. And so really what she, has gone through and what she is looking at from her entire life is, which pill do I need to take to help me sleep better or feel better or have more energy? Where a lot of times the answer can be in making those positive personal changes in our life that get us back into that balance. And that's I think is a better approach to dealing with chronic diseases. So I think, really understanding some of the challenges that we're having is many of the medications that we use were actually studied for very short-term uses, but yet we've got people that are taking them for decades. And so we really don't well understand the long-term impacts of using certain medications, for years and years. So I want to ask you about your own path to healing and working through, your own trauma, you wrote this amazing book, Trading Grenades for Candy. And I really want to dig into that. Why did you write that book? What is that book about?
So the book is my memoir. It's the title was inspired by this encounter I had with a U.S. Marine that was deployed. So I'm originally from Iraq. So this goes back to Operation Desert Storm in the early 90s. So I was only 7, and I had an explosive in my hand. Shiny explosive, looked like a toy to me because I was very young. And then I realized a U.S. Humvee honking at me, and because they thought I was in danger. So when I turned around all terrified, they were waving a bag of candy at me for exchange of that explosive in my hand. So that's what inspired the title of the book, Trading Grenades for Candy. But the book talks about my long journey of escaping war, going through immigration, displacement, being a firsthand victim of discrimination coming to the U.S. post 9/11. So there's a lot to be said about what it takes to be an immigrant, to be a member of a minority. So the book goes through all the stages of my life until I am a pharmacist and that discovers herself through her world travel. So it just got released this year in March, and it has a lot to say about members of the minority. But there's also a lot of trauma that goes into the book. But because the book was getting very lengthy, we decided to kind of talk about the mental health aspect of it. In the second book, which I just finished, it's under The Traumas We Carry and Finding Healing in a Toxic Culture, which I'm really, really excited about.
Me too. I cannot wait to read that one. So, I think it's interesting to talk about, because I think when we explore trauma, especially our own traumas in childhood, people tend to think, well, I didn't have anything major that happened. I didn't have big T traumas, but people can still experience trauma being in a situation that they are not prepared to handle. And so I think there can be an approach to trauma for everyone. And I love how you talk about, really it wasn't affecting your life until it started affecting your life. And so you had gone back to Iraq and was working with Doctors Without Borders. And so how did that experience of going back there bring up some of the memories and was a type of trigger for you to really understand how this was affecting you in your day-to-day, and how you began making different choices in your career as a result?
So I was completely unaware that I had PTSD all my life from all the abnormal societal circumstances that I was exposed to as a child. So when I graduated from pharmacy school, I just there was just unfinished childhood business that I often refer to, a lot of unfinished childhood business that I subconsciously, without having any awareness, that I was craving to finish because it was unfinished. So me going back, it was more of like those memories from childhood, because I had no choice but to leave my mother country. So when I went back, it was a complete culture shock for me, because what I had in my mind was no longer there. And then I realized that everything was different for me. The culture was different. People were different. Experiences were different. And then I realized nothing has changed. It's Helen that has changed over the year, after 26 years of living abroad, being, Americanized in a way, and then trying to implement her, the changes in her mother country, through her American lens. So there was a huge conflict there, in terms of changes in the culture and the views. But then when I was providing care for those little girls from Western Syria, as well as other parts of Iraq, because of, civil war, I realized that I was caring for a mirror images of myself when I was 7 years old, going through war, going through conflict. And every day the depression would wash over me. And then I would hear voices inside myself crying for help. Well, what about me? You've ignored me over the years. So it was my inner child asking for help. And it was just, like I said, disease, it's as much as it's a curse to have a disease, but there's a lot of blessing to be said about having a disease, because a disease, it's a way of telling you that you have to wake up. It's a way of telling you that you absolutely have to do something that you call normal, because in this society, what we call normal, what we call healthy, it's neither normal nor healthy. So to me, when I came back to the US after serving 3 years overseas, I was diagnosed with complex PTSD. As much as I was devastated, my family was devastated, because back then PTSD was considered to be a mental disability. I decided to take the wisdom path and share my challenges of living with PTSD with the world. So I feel like that's what led to my awakening to become a trauma informed from my own personal struggles of living with it, and grasping the knowledge necessary that led to my healing, and also sharing my message with the world.
Oh, I love that. And thank you so much for sharing it. I think it comes, it as healthcare professionals, we tend to struggle in silence many times. And this is something that I hear healthcare professionals talk about all the time. Well, I kind of thought I was depressed. I diagnosed myself. And so I've been working on it myself, whether we're, self-medicating with alcohol or staying busy. I think that even the act of staying busy can also be kind of seen as a trauma response to keep that that autonomic nervous system going. Yeah. And so some of the conversations we've been having around autoimmune diseases and the autonomic nervous system, really understanding what works for us, individually, because I think this whole blanket cookie cutter medicine approach doesn't work for trauma informed care. And that's what I really like about trauma informed care. It's personalized. It's about connecting with someone so that you can work with them, work alongside them. It's a very empowering message that I think patients need to hear is, you have the ability to heal. You have the ability to reverse many of these diseases, especially those that are related to chronic stress. And how we talk about these options affects how our patients perceive them, because there is a stigma around mental health and PTSD. Who is going to change that if not us? So my question for you is, how can we begin healing the healthcare system as professionals? How do we begin making different decisions?
So to go back to the point of, explaining how, going back to the definition, the trauma 101, a lot of people limit trauma to what happened to them. But if you take that approach, then what happened can never be fixed, because the past is gone, right? But I like to have an optimistic look at trauma. Trauma is what happens inside you now because of what you were exposed to in the past. And there is a lot to be said about that, because what happens inside you as a consequence of your early childhood exposure or earlier exposure to trauma, what's inside gives us hope, because there is hope for healing. And healing, like you said, it's possible. It starts within us. So that is, I just thought I should share that little bit about trauma, because a lot of people are caught up that so this and this happened to me. That's not what we need to be focused on. What we need to be focused on is what is the consequence of what happened to you, and how can you alter that physiological changes, that the disruption in the energy flow in your body because of what happened to you. So that's the first step, is to change that perception of how we look at trauma. It's because it gives a lot of hope. It leaves the door open for healing. How do we start healing? It goes back to the point I was making earlier, Blair, is having a holistic look. Don't compartmentalize, the human organs. Like, don't treat the heart separate from the mind separate from the vagal tone. You absolutely have to put all the three systems together in order to, seek healing. I know if you asked me 2 years ago that, Helen, you need to do 45 minutes of mindfulness, I'll be like, you are out of your mind. Because, and I'm sure you've been hearing some beepers coming as I'm speaking. We live in a disruptive society. There are beepers coming at us, cell phone ringing, text messages coming in. It's hard to stay focused. And again, we live in a society that exploits the autopilotness in all of us, the trauma in all of us, because there's just constant distraction coming our way. And when you're telling me, well, you absolutely have to turn everything off and just meditate for 45 minutes, I am asking the impossible of you. But what I did is I started baby steps. Again, it started with compassion, curiosity, replace the judgment with compassion. And I know it's hard because I often tell people the most difficult relationship you could have is the one with yourself, because trauma comes with a lot of shame. Trauma breaks you down. It's what doesn't kill you. It really breaks you down into pieces, because it was just, the event was too much, too fast, too soon for your brain to comprehend. So when you feel broken down, that's exactly what shame is, because shame's perceived the identity as broken. So it's having that hard look at yourself, having the holistic look, and taking a step back and living in the moment. And Blair, I am part of TED International, and I loved this TED that talked about how, during metacognition, which is mindfulness, yoga, and pranayama, the deep breath, they equated that metacognition to artificial intelligence. And I know that's such a hot topic in the profession now, especially our male colleagues who live in a toxic masculinity. They're like, oh, there's no way I can just put my hand on my heart and just say, I love myself. I love myself. I love myself. Because it's difficult. We, again, in a toxic culture, male have to be masculine. They cannot speak in an intimate manner to themselves. But if you do that enough time, just like artificial intelligence, the body starts reacting back to you. So having that deep connection with yourself, coming to consensus with yourself. But we live in a society that disconnects us from ourselves. The next, thing you realize, you're like constantly spending time on, your cell phone, social media, binging on Netflix. Time and time again, we hear students, well, I'm going to do something to kill time. Killing time means disconnecting yourself from your own body. And then the next thing you realize, your body is completely a foreign entity of you. So coming back to yourself, it starts with metacognition. And it's extremely, extremely hard, because you've been in an autopilot, disconnected from your body for so long. So trying to come back to yourself after all these years, it's going to be extremely difficult. It's a foreign concept, and especially talking to yourself is a foreign concept. But it starts with a baby step, just like how anything new and difficult in life, it starts difficult, but after multiple practices, it becomes a routine. It becomes a norm. So I do metacognition first thing in the morning. And it's important to understand the timing of the day. When you first wake up in the morning, the waves of, the brain waves are not as fast, right? It's slow. And that's when you want to catch yourself to regulate that amygdala, which goes through hijack, because we live in a society that dysregulates all of us, right? But when you wake up first thing in the morning, you are in a alpha state, which means the meditated state. So you want to hold yourself, meditate for 10 minutes, and that's not a lot to ask. And then that regulates your amygdala for the rest of the day. So you're already setting yourself up for a success. But if you wake up and you're already dysregulated, imagine what a disaster you're setting yourself up to for the rest of the day. So it's important to have the basics, the attention to the basics, and see what is it that you can do to regulate yourself. Yoga is the same thing. It's about coming back and connecting to your body. And pranayama, the deep breath, is to regulate that amygdala, to calm yourself down. It sounds simple, but it's extremely difficult. But again, everything with practice definitely gets better over time.
Absolutely. I practice transcendental meditation, and I was introduced to it first through Maharishi International University. I was working on my master's in consciousness and human potential, and they kind of did compare tapping into the space between the thoughts, and what meditation has helped me do more than anything else. Even just a brief daily meditation, for one, it helped me to notice how I'm breathing. Yeah. A lot of times we're breathing like, very short and heavy all day long. So sometimes to be able to take that first deep breath of the day, it feels so good. And when you get into that practice of, oh, this is how I calm myself. This is how I regulate my nervous system. This is how I get back to a state of homeostasis that works for me. I think people can try different types of meditation, yoga, deep breathing, pranayama. I think that there's so much information out there for people. And I was one of those, like, I have 3 kids. I'm running 3 different businesses. I don't have time for meditation. And it really was when I got to a point I craved that time. I craved that alone time. I'm actually an introvert. I don't know if you know that, if you believe that, Helen, but I'm actually, I like to spend quite a bit of time by myself, thinking and reading and writing and getting, processing is like, that's my time for processing kind of what went on in the day. So I have an alarm on my phone. I've got all the notifications turned off except for my Google alarm so that I know where I'm supposed to be. But I have an alarm at 9 p.m. every night that says, turn off the TV, turn off your phone, and do your meditation. And so it's just that simple to set something up to begin making it part of the routine of your day. So I want to play devil's advocate, because I know pharmacists and healthcare professionals out there going, I'm too busy, to be able to do this. We touched on this idea that your body, and when you're in touch with your body, can speak to you. And when your body is saying no, there's a great book called The Body Keeps the Score. Yeah. And so, I always recommend that to people that are just kind of getting into the mind, body, spirit. And I think that there's so much burnout, there's so much discontent happening in healthcare because it isn't in alignment with what we believe and with what we know is healing medicine. So I want to ask you kind of last question for today. What would you recommend? How would you recommend, the pharmacist or the physician or the nurse who's out there and feels like they are being asked to do more with less? It's like sacrifice yourself at the expense of your patients, at the expense of your employers. This was really the reason that I created the Pharmapreneur Academy, was to give pharmacists and healthcare professionals skills around building their business, around building a consulting business, so that they could have another income stream beyond working with employers. So to actually become an entrepreneur and have more ownership over your time. What are you seeing in pharmacy? What is your message working with the Florida Pharmacists Association and being a leader in trauma-informed care? I would love to hear, what you would recommend for the individual that is maybe just starting this journey of realizing that their nervous system is dysregulated and their body is keeping the score and it's screaming no more, and helping, really helping them to move through that in a way that if they're struggling, they can, they can find, some comfort and find information that helps them move through.
So there is another book, Bessel van der Kolk. I mean, I love that book. I've read When the Body Says, Not When the Body Says No. That's another book by Gabor Mate, but The Body Keeps the Score. And the reason why he calls The Body Keeps the Score is because the brain's neocortex, which is the part of the brain that is responsible for the complex and the executive reasoning of our brain, does not fully develop until we're 25, Blair, which means we human, we are the byproduct of our environment. So when I go back and tell you that we live in a society that exploits trauma in all of us, between, from the time we're born until we're 25, we are the byproduct of the society, the religious dogma, the dysfunctionality in the family that the child is exposed to, whatever the unbearable work conditions. Until you're 25, your brain is not fully developed to execute, complex decision making, and realizing what's happening to you is not healthy. And that's just the way the human brain apparatus is being set up. Another book that I highly recommend, if I may, is The Myth of Normal by Dr. Gabor Mate. It's a ginormous book. I just got done reading it. Phenomenal book. It talks about how we live in a society that, where we think it's normal, it's actually not normal, is making us sick. So he has, like, Dr. Mate looks at the society from a very different lens, from his own trauma lens, just like how I look at some of the stuff from my own trauma lens. Now, making the shift in talking about burnouts, I think burnout is equivalent to trauma. Burnout it gets to a point where you develop a scar. Burnout is irreversible. And I also want to make a claim that I am not encouraging anybody to do yoga, meditation, and mindfulness when they are at a point of no return, which is burnout. Burnout is costing you your health. Burnout is costing you your life, because when you are burnt out and you go home, that child does not have that neocortex to reason that mom is having a bad day, dad is having a bad day at work. They are going to personalize your trauma at home, and they're going to say, gee, I must be bad. That's why mom is it's abandoning me. That is how a child thinks, and there is just no way around it. So the negative vibe, and that's why I think this whole work-life balance is extremely flawed. It's extremely inaccurate, because we're not robotics. Whatever we go through in our work arena, it translates to the family environment at home, and the child pays the cost of that, because for them to be so vulnerable, for them to crave that deep attunement from mom and dad are so overwhelmed, they're so checked out. What the child is going to do, the child is going to tune out, because that's their way of coping with you abandoning them. So, but do the tuning out enough time, that tuning out, even though at the beginning is a survival mechanism for that child, but then that child, takes that tuning out to other environmental settings, such as classroom, work environment. And then the next thing you realize, the teacher calls the parent that your child is daydreaming, and that might be ADHD. So that's why ADHD is it's so on the horizon. I think it's the cost of the civilization and the burnout that we're dealing with here in the 21st century. So just to put some things in perspective, why I think burnout is a point of no return. There is no remedy. I know I was at a point, not long ago, in one of my my roles, and I absolutely had to resign because I was at a point of no return. And I would like to say that if the cost of your health is too expensive, because there is no way and no valid reason for anybody to put up with toxic work environment, because the no that you're telling yourself, the no that you're deceiving yourself with, it's a matter of time for that no to show up as a disease. And it goes back to the point that I was making earlier, how there is a lot of wisdom to be said about the disease. The disease is the outcome. The disease is not genetics. The disease is not to have a reactionary look and dump the patient with pills. The disease is to take a step back and look at it. What is it that you've done to disrupt that normal energy to go through your body? So disease is a normal response to abnormal societal circumstances. So if you push through yourself through toxic work environment, toxic relationship, toxic whatever, it's only a matter of time for that no to show up as a disease, to wake you up and tell you that enough is enough. So there is a moment of reckoning. I hate to say that. And that's probably why we're having a mass exodus by our colleagues in the country. And that's because of a burnout. Why post COVID-19? Because COVID-19, it was an era of realignment. COVID-19, it was an era of awakening, and COVID-19 was an era of reflection. I know myself, I put a book together on the traumas we carry, but I'm not alone. A lot of people discovered this hidden creativity inside them. A lot of people have woken up. And not to forget, there was a lot of mass layoffs, and people realized, well, gee, I got laid off, but I was just fine. I thought I was not going to be able to provide for my family. And then we saw our loved ones being laid off, and we got by just fine. So now people are no longer able to put up with what was okay, because what was okay was not okay. So that's the era of reflection, the era of realignment. And I think that's probably why we're struggling with the Great Resignation now, because people are identifying that what they put up with is making them sick, and there is absolutely no reason for us to put up with that. So I am, as much as I like to provide guidance on a burnout, I was on the receiving end, and unfortunately I had to make a tough decision for myself to resign without having a job lined up for myself, because it was costing me my health, and nothing in the world is worthy of your health. So I cannot decide for a pharmacist. I can only decide for Helen. But if you feel like, and whoever is listening to us today, if you think the conditions you're in, it's at a point of no return, that's a decision you have to make. But just realize the burnout and the cost of the trauma that is having on your child, on your environment, on your marriage, on your health, most importantly. And it's time for you to have that tough conversation with yourself. And is this what you're going through? Is it manageable, or is it too much, too fast, too soon that is impacting you? Only you are able to make that decision for yourself.
Absolutely. Helen, thank you so much. This has been a fantastic conversation. And I definitely have seen COVID and the Great Resignation to impact and to really awaken healthcare professionals to this idea of, is our work in alignment with what we're doing personally I have such a healthy respect and reverence for the technology that we've been blessed with. And I think that there needs to be this balance of how we are approaching the energetic body as well as the physical body and the spiritual body. So I want to thank you so much for your advocacy in this role, for sharing your amazing story. I will post a link for you guys to Helen's book on Amazon. That's Trading Grenades for Candy on Amazon. And Helen, thank you so much for your work and for sharing your story and for joining us here on the Healing Medicine Show.
My absolute pleasure. Any platform I get a chance to share my message, it brings a lot of delight and joy to me. Thank you so much for allowing me to share my expertise with you today.